Good evening and welcome to our nightly telecast of Just the News, where we'll give you all of the important information about the happenings and the going-ons across the country today. Let's get straight to it. India has now recorded 3,23,000 COVID cases in the last 24 hours, 2,771 deaths. This is the sixth consecutive day where India has recorded more than 3 lakh cases. Maharashtra remained the worst affected state, followed by Uttar Pradesh and Kerala. Maharashtra reported over 48,000 cases in the last 24 hours. Now, the courts have been very active when it comes to the management of COVID. Let me take you through everything that's taken place in our courts today. The Supreme Court is hearing its suo motu case on COVID management in the country, which basically suo motu means the court has taken cognizance and pulled up that case without anybody having to bring it before the court. It has asked state governments to file a report on the health infrastructure in their respective states by Thursday. The court has also not restrained any of the high courts from passing orders on COVID management. The bench in the Supreme Court said, and I quote, "High courts are best situated to make an assessment of ground realities in each state and find flexible solutions for problems faced by citizens." It also noted that at a time of national crisis, the Supreme Court cannot be a mute spectator. The bench asked the central government to explain the basis and rationale behind the pricing of anti-COVID medicines and other necessary items. The Supreme Court on Tuesday also appointed senior advocates Jaideep Gupta and Meenakshi Arora as amicus curiae for this suo motu case that it has taken notice of after Harish Salve had recused himself. Now, the amicus curiae is a court-appointed lawyer to argue that case. The Delhi High Court hauled up the Delhi government today for rampant black marketing of oxygen and medicines in the national capital. The division bench of Justices Vipin Sanghi and Rekha Pali, who have been hearing all of the cases so far, said, and I quote, "Our confidence is shaken. Pull up your socks and put your house in order. Enough is enough. If you cannot manage it, tell us and we will ask the central government to send their officers and take over. We cannot let people die like this." The court asked the government to take over a cylinder distributors unit in Dwarka and directed the Delhi government to take action against black marketing of oxygen and medicines, noting that it has failed to do so far. "There's hoarding going on of both medicines and oxygen and you are doing nothing," said the court. On reports that people were demanding about 1 lakh rupees per oxygen cylinder, the Delhi High Court said oxygen cylinder distribution is your baby to the Delhi government. You have the powers, exercise them. If someone is engaging in black marketing, take action. They need to be taken to task. Bring them before us and we will take action. End quote. The Delhi High Court also told the Delhi government that it cannot hope to fight COVID, issuing unreasonable orders to hospitals. Now, this is after the Maharaja Agarsen Hospital told the court that it's impossible to follow the government's direction, asking them to provide oxygen and medicine within 10 to 15 minutes of a patient reaching the emergency room. The court said to the Delhi government that you are completely out of sync. You do not know what the ground reality is. You do not know how hospitals are coping with the situation. Why do you come up with these orders? It added that it would have been understandable if the government had taken action if there was some inspection at a particular hospital where it found insufficiency or people were not discharging their duties. The Delhi High Court also severely criticized the Delhi government for its recent order where it had provided 100 rooms of the Ashoka Hotel for setting up a COVID facility for the use of judges and their families. The High Court clarified that it had made no such request of the Delhi government and it had not asked for any special treatment. It asked the Delhi government to take corrective steps in terms of that order, else the court will quash it. The Madhya Pradesh High Court has taken into account 3 interim applications filed about the supply of oxygen and said, and I quote, that it is the opinion of the court that it is the responsibility of the central government, which is allocating quota of oxygen to various states, to get its directives complied with and ensure seamless and hindrance-free supply of oxygen. It is also expected of every state, including the state of Uttar Pradesh, not to obstruct the movement of oxygen as per the allocation of the central government to any other state. Recurrence of such incidents will hinder and disrupt the timely supply of oxygen to hospitals." End quote. The Gujarat High Court has expressed its unhappiness over the response filed by the state government. The court said the state's affidavit is painting a rosy picture and is not in touch with ground reality. We can't sit in ivory towers. The state has to take steps to break the chain. On reports that hospitals are admitting only patients who are coming in through the government-run 108 ambulance, the court said no matter which vehicle, private or government, patients are coming in on, how can doctors say that if you're not coming in on a government ambulance, we will not treat you and we will let you die? The state government has been directed to file a report indicating measures it has taken to deal with the COVID situation in the state. Amid criticism that several states have accused the Serum Institute of India and Bharat Biotech of gaining profits from the COVID crisis by overpricing the vaccines to state governments and the private sector, the central government has now asked pharma companies to lower their prices. Remember, the Serum Institute had announced a pricing of 400 rupees for state governments and 600 rupees for private hospitals for its Covishield. And Bharat Biotech had announced 600 rupees for state governments and 1,200 rupees for private hospitals. Both vaccines are available to the central government at 150 rupees a dose. On the other hand, the Serum Institute of India has defended its pricing, which is 1.5 times the initial rate, saying that the earlier price was based on advance funding and right now it needs to focus on scaling up and expanding capacity. Bharat Biotech Managing Director Krishna Ella has said that recovering its cost right now is essential for innovation. The Chief Minister of Haryana, Manohar Khattar, on Tuesday has said that it is useless to debate death data as dead people will not come back. He has said, focus on ensuring affected people recover from the disease. Speaking to ANI, he said, and I quote, given the dangerous situation we are in now, we should not have debates over the death data. We should instead focus on people who can recover from the disease. Those who die will never come back. We will try our best to save everyone. There's no point in debating the number of deaths, whether it's actually more or less, he added, end quote. The centre has put out guidelines for state governments enforcing lockdowns and containment zones to try and flatten the curve. According to the rules, restrictions will be imposed when the positivity rate is 10% or more for a whole week and more than 60% of the hospital beds are occupied. The Union Ministry has urged states to go in for intensive local and focused containment networks in districts, cities and areas based on parameters specified. Following a report in a newspaper in Australia called The Australian that was titled, and I quote, Modi leads India out of lockdown and into a viral apocalypse. The Indian High Commission in Australia has criticised the report and called it baseless, malicious and slanderous. According to the article that was published in The Australian, it basically said the rise in COVID cases in India was due to factors like allowing thousands to attend election rallies, permitting the Kumbh Mela and ignoring experts' advice on more infectious strains and critical shortage of medical oxygen and vaccines. The Indian High Commission has accused the editor-in-chief of the newspaper of publishing a report written with the sole objective of undermining the universally acclaimed approach taken by the Government of India to fight the pandemic. It also said that a massive upgradation in diagnostics and treatment facilities were undertaken in record time and have saved hundreds of millions and have been praised by the global community. The Punjab government has announced a weekend lockdown which will be extended now and a night curfew extended by 2 hours. In Punjab, shops will stay open till 5 p.m. after which a night curfew will be imposed. The Kerala government, starting the 27th of April, has decided to close cinema halls, malls, gyms, clubs, sports complex, swimming pools, entertainment parks and so on. All gatherings have been banned. Shops will be closed at 7:30 p.m. In Assam, there's a night curfew from 8 p.m. onwards, starting with immediate effect until the 1st of May. Only emergency services will be allowed. Gujarat has imposed a night curfew in 9 more cities starting 8 p.m. Until now, there was a night curfew in 20 cities. Malls, shopping complexes, cinema halls, parks, gardens, salons are closed. Weddings are still allowed, 50 people at weddings, 20 people for funerals. But despite a very high instance of COVID in Gujarat at what is being reported at 14,000 cases a day, no complete lockdown has been announced in the state so far. Goa's health minister has said a lockdown in the state is crucial to save lives. He said in his interaction with experts, he's been told that Goa might lose 200 to 300 more lives in the next 10 days, and the situation is really grim. He also said he's confident the Chief Minister will take the request into consideration on priority. The Goa Chief Minister, Mr. Pramod Sawant, on the other hand, had earlier said a decision on imposing a lockdown had not been taken yet, and he added that stricter curbs on gatherings may be considered. In Maharashtra, and I warn our viewers that this is a distressing story, in Maharashtra, bodies of 22 COVID victims were all crammed into the back of one ambulance when they were being transported to the crematorium in Bhid district of Maharashtra. The incident triggered outrage among people, and a probe has been ordered in the matter. According to a report in the Times of India, the police apparently snatched away the phones of family members of two of those victims who were taking photographs of those bodies being crammed into one van. Their phones were apparently only returned after the last rites were performed and completed. A quick look at news coming in from the world of business, although it stays in the area of COVID. Following Google and Microsoft's announcements, which we told you about yesterday, Amazon and Apple have also stepped in to help India in this COVID crisis. Amazon is working with industry partners and NGOs to urgently airlift about 8,000 oxygen concentrators and 500 BPAP machines, which helps people breathe, from Singapore. It's also procuring 1,500 oxygen concentrators and other critical medical equipment to be donated to hospitals and medical facilities. Apple CEO Tim Cook tweeted that amid the devastating rise of COVID cases in India, our thoughts are with the medical workers, our Apple family and everyone there who's fighting this awful stage of the pandemic. Apple will be donating support and relief efforts on the ground. Taking a look at now news coming in from across the world, unfortunately also staying in the area of India's COVID outbreak. WHO chief has said that the situation in India is beyond heartbreaking and that the WHO is sending extra staff, supplies to India to fight the pandemic. He said the WHO has deployed 2,600 staff members from other programs in India to support the effort to fight the disease. Australia has announced a temporary ban on flights from India from till the 15th of May due to the surge in cases of COVID in the country. Australian Prime Minister Scott Morrison said the suspension will remain in place at least until the 15th of May because of risks currently in travel to India. This move leaves thousands of Australians and high-profile cricketers stranded in India right now. It follows similar moves made by other countries, Canada, the UAE and Britain, to halt and restrict flights in response to our COVID cases. Looking now at what's going on in the world of sports, also connected to the world of COVID. A letter addressed to the players of the IPL has been released by the BCCI. BCCI COO Hemang Amin has said the BCCI is monitoring the situation very closely and working with government authorities to make arrangements to get foreign players back to their home countries once the tournament concludes on the 30th of May. The letter read, and I quote, as some of you have said, if we can help distract people from their troubles over the recent times, even for a short while, we have done a great job. When all of you walk out into the field, you bring hope to millions of people who have tuned in. If even for a minute you can bring a smile on someone's face, then you've done well. While you are professionals and will play to win, it is time to also play for something more important, humanity. End quote. This comes after 3 Australian players quit and left the tournament due to the surge of COVID cases in India. Finally, leaving you with a piece of good news. A group of founders of startups in India who call themselves Mission Oxygen have managed to raise 9.2 crore rupees in 48 hours to import 1,365 oxygen concentrators from Hong Kong to hospitals across Delhi. These concentrators apparently are on their way. They have said that words can't express how grateful we are for the help from the community to make this happen. We are in constant touch with the government and with hospitals through this process and have recently come to learn about this requirement, which is larger than we had anticipated. So they have continued their fundraiser, which is on keto. the link of which is in the description of this video. Several startup founders from across the country have been working very hard to pool their resources. For example, according to Business Insider, online travel company Ease My Trip has confirmed that founders are allocating resources to import oxygen concentrators to India. Several others are doing similar work, and we will bring you information about the work that's being done by civil society. Many founders of startups right now who are coming together, and many people in the business community who are raising funds to import oxygen concentrators and other equipment into India, and we thank them. But there are also thousands and thousands of people who are not named across the country, volunteers who are making phone calls, connecting the dots between people who need hospital beds and oxygen and ICUs and those who are in charge. We thank them for their efforts, because it is, and I know in person, it is a very draining process, because you get invested in every single case that you're working on. But people continue to do this work across the country, amplifying cases and finding solutions for them. We thank each and every one of you for the work that you're doing. Remember, stay home and stay safe. The source articles of all of the news that you heard on this bulletin is in the description of our YouTube page. Please subscribe to our YouTube page as well. Thank you for watching. Good night.